High-tech equipment is making a dramatic impact in one of the Bay Area's busiest trauma centers. It's also allowing surgeons to repair some of the most extreme bone injuries with a new level of precision.
And that piece and that piece kind of help us put this together also.
So that's how broken apart it was?
Yeah,
in there?
exactly.
Nobody likes looking at an unflattering picture of herself, but Jenna Quarn's case is more severe than most. The animation on the screen is a snapshot of her crushed pelvis.
And the ball went into the socket and blew up the ball.
The injury happened several weeks ago when Jenna fell on her bicycle near the Muni tracks in San Francisco.
I was in the middle of the road and knew I had to get up, and I couldn't.
The multiple fractures were so severe that she was sent to the Orthopedic Trauma Institute at San Francisco General Hospital, where sophisticated computer-guided technology is used to both plan and execute complicated repairs. First, special software turns CAT scan images into a three-dimensional model of the fracture.
I look at the non-broken side and I flip it or mirror image it to the broken side, and then after doing that I can plan on how to put the pieces back together.
Sensors are then placed on the pelvis. Using infrared light beams, the computer software gives an interactive roadmap of the fragmented bones. It's precise enough to provide both location and correct angles for placing surgical hardware.
If I, just for demonstration, move this to the wrong position, what you'll see is that it'll tell me that I'm inside the head of the femur. You see it says break in.
That precision is especially critical with pelvic fractures.
The pelvis has certain corridors of bone that we can place hardware into. Those corridors are usually between 4 millimeters and 10 millimeters in diameter, and the screws are about 6.5 millimeters in diameter.
In other words, leaving a razor-thin margin of error. And although it might not look like it, the result is a reconstruction that actually uses far less hardware than traditional methods.
The screws go inside the corridors instead of being on top of the bone, they're inside the bone. So that's pretty strong.
Jenna began rehab shortly after the surgery. Now she's hoping to be back at work as a delivery room nurse in a matter of weeks.
Getting back to the moms and babies and just everything I'm looking forward to.
And as for the bicycle?
Maybe.
Well, doctors say the computer-guided system also delivers far less radiation to the patient. That's because once the initial 3D image is created, surgeons do not have to continue capturing images of the area during the procedure.